To kind of get started, for those listening that are unaware of what it is, what is PCOS? What does it stand for and what does it mean?
PCOS is polycystic ovarian syndrome. It's kind of a misleading name because having multiple cysts on your ovaries doesn't diagnose you with polycystic ovarian syndrome. So I really wish it was named something else. But, as many as about 25% of women have cysts on their ovaries, but most of them have no issues with that at all. So PCOS instead is more a name for a group of symptoms that tend to connect to irregular menstrual cycles or trouble conceiving. So it's more a combination of lots of different types of symptoms, and it's going to be different for everybody. So some people only have a couple symptoms, some have everything on the list, and I might have 3 symptoms and you might have 3 completely different symptoms, but they're both called the same condition. So it really is something that varies drastically person by person. And so sometimes people can have some trouble with figuring out how to deal with their PCOS because it is so different between individuals. The treatment needs to kind of be the same way. And a lot of times it's a one size only approach, and that doesn't really work for everyone.
Yeah, absolutely. So for those listening, like who can get it or who is mostly affected by it? I guess like what would studies show? Like, is there a certain age group or is there a certain background, or how does it affect certain people?
Basically, anyone who has ovaries could have PCOS, but generally it's something in women in their childbearing years. And what's complicated is that a lot of women will go on hormonal birth control to deal with symptoms regarding their menstrual cycle, maybe even into high school, and have been on it for many years. And a lot of times they don't go off of it until they're ready to get pregnant. So the hormonal birth control can mask some of the symptoms of PCOS. So a lot of people can have it without knowing they have it until they try to get pregnant and then run into trouble getting pregnant. So, it can be tricky to diagnose and take a long time because there's all sorts of these other variables that can impact it. But generally it's women in their childbearing years are the ones that are usually diagnosed.
Oh, interesting. That's so interesting about birth control, hiding the symptoms. And then, so once they are off the birth control, ready to conceive, is that a lot of times when some of those symptoms will come out and they kind of realize? Interesting.
Exactly.
So now that we're talking about symptoms, so what are I know you said it differs from person to person, which I think a lot of these things kind of do, but what are some of the symptoms or common symptoms we do see with PCOS?
One of the biggest ones is irregular menstrual cycles. And for most people, that's when they're getting diagnosed. Is they're trying to get pregnant, they're not having normal cycles, they're not ovulating. It's kind of hard to get pregnant if you're not ovulating. So that's usually the start for many people, but that's just one of the possible symptoms. So other ones can be oily skin, acne, anxiety and depression, weight gain, high androgens, which are male hormones. So high testosterone, DHEAS, and those types of hormones that would show up on a blood panel. So if you get blood work for hormonal levels, that may show up. A lot of times that's another first indicator for many people is to get a hormone panel and see really high testosterone. That's a definite sign of possible PCOS. Thinning hair on your head, that's definitely one that I have. And thankfully I have curly hair, so I get to hide it a little bit. But, if I put my hair straight in a ponytail, it's like smaller than my pinky finger. I have tons of thinning in my hair. Another one that's no fun that I definitely have as well is a lot of male pattern hair growth. So on your chin, some people get it on their chest or their back. So dark hair on your face, hormonal acne that tends to be around the mouth and chin is a sign of hormonal acne. The thinning on the head with hair on the head, difficulty getting pregnant. If you have a ultrasound done, which if your doctor thinks you may have PCOS, that's usually one of the things that they will do. And on an ultrasound, if you have PCOS, you tend to have what they call a string of pearls around your ovaries. It's kind of the little name they give to it, but it's multiple follicles around the ovary. And usually when you're ovulating normally, one of them gets bigger and then releases an egg and it diminishes all the other ones. But with PCOS, a lot of times your body is trying to ovulate and can't quite get there. So it just does it over and over and over again. So you just have all these extra follicles around your ovary. And that's another possible sign or symptom that can be seen on an actual test.
Okay. How then would someone get diagnosed? Because, like you said, the symptoms are so different for each person. And my guess is each of these symptoms doesn't necessarily mean you have it. So, how does one go about getting diagnosed with it?
Well, first step is to talk to your doctor, and they're going to go through your medical history. There is a hereditary component. So sometimes if you have family members that have it, that may lean a little heavier, that might be what you're dealing with as well. I know that's something that I have family members who have the same condition. So there's definitely a hereditary component. But having that medical history conversation with your doctor is usually the first step. If they think that there's enough there that may lean towards PCOS, usually they'll order some blood work to check for hormones and levels there. See if you have high male hormones like testosterone. And then also usually there's a pelvic exam and or an ultrasound to see if there's anything else going on or see what your ovaries look like. And it's really taking all of those different pieces of information together to see if it makes sense that, there's enough here to say that PCOS explains it, not something else.